Okay, guys, this is Mubin. We're talking about hemodynamics, cardiovascular system general principles, and in that, the lecture today is about the blood flow. So let's talk about it. There are some assumptions that we'll make throughout the hemodynamics that, and some facts that we'll keep in our mind. One is that 1 meter is about 39.3 inches, so about this big. 1 milliliter can also be said as 1 cubic centimeter. So this is 1 centimeter here, and 1 cubic centimeter means that this is a cube that is equal to 1 centimeter on all of its dimensions. So 1 milliliter of blood, whenever you think about it, you can also think about it as a cube which is 1 centimeter on all sides. That will be important when we are doing various formulas where we need to convert where the units need to make the units the same. We've also, forget about this, we did this with the last lecture, velocity and flow difference. Velocity is the distance covered in unit time. So if this is an RBC and this is 1 liter of blood and they both are going with the same velocity, that means the distance covered is the same. It doesn't matter what their volumes are. Flow is the volume per unit time. So if the RBC goes in 1 minute from point A to B, then we'll see very small volume. When if 1 liter blood goes from one point A to the other point, then we'll say that 1 liter blood moved. So that is the difference between the velocity and the flow. And the calculation, when we do that, we would assume that we're talking about a healthy individual adult with an average calculation of cardiac output 5 liter per minute. Okay, so the cardiac output of 5 liter per minute will be the number that we'll use wherever needed. Now, the formula for the flow of the blood or a fluid is, so Q here, milliliters per minute, that is the units we're using, is the delta P over R. And what does that mean? So let's say this is a tube through which we're talking about the flow of the fluid. The delta P, or the pressure gradient, is the gradient in the barometric pressure on the two ends of the tube. So here, let's say this is P1 in millimeters of mercury, and let's call it 120 millimeters. That is equal to systolic blood pressure. And here P2 is, let's call it 4 millimeters of mercury, some venous pressure, right? So that is the pressure difference. So we have a lots of pressure difference. About 116 millimeter of mercury is the difference. That will be called delta P in this case, or the pressure gradient. So again, the formula is the pressure gradient in millimeters of mercury divided by the resistance of this length of the tube. So how do we know the resistance? There is a formula, but I'm not doing the resistance right now. All we can say is, which is important, is viscosity of the blood, length of the tube, and then the radius. These all affect the resistance. So we'll know the resistance, and what we'll have to do is put that formula down here. So here P1 minus P2, the pressure differences, and then the resistance. Now the question that is really important is, as a medical student, as a doctor, what do you plug in the values as the pressure differences, as the pressure points? So in our body, what we do is we use mean arterial pressure as the P1. And then P2 is wherever you are interested to see the pressure or the flow between, you'll use the P2 there. So how do we get the mean arterial pressure? We've talked about it in the past in another lecture. So we know the formula is cardiac output multiplied by total peripheral resistance plus central venous pressure. However, in practice, getting all these numbers is really difficult. So what we do is we use a rough estimate that we can actually use within our clinical practice, and we can derive that number from systolic and diastolic pressure. What is that? You take pressure diastolic plus you take 1/3 of the pressure systolic minus pressure diastolic, which is the pressure difference. And if you add them, that gives you the rough mean arterial pressure. So if I do that math over here very quickly, in this healthy individual with a cardiac output of 5 liters per minute, we'll also assume that systolic pressure is 120 millimeters of mercury, and he has a diastolic blood pressure of 80 millimeters mercury. With those numbers, what I'll do is I'll say 80, so that is this plus 1/3 of the difference in systolic and diastolic. So 120 minus 80 equals 80 plus 1/3 of 40. This comes to be 93 millimeters of mercury. That is what we'll use as the mean arterial pressure in our formula here. So now let's see a blood vessel, this system that has a 4 millimeter P2. Let's look at the flow and the resistance. Let's make the resistance as 1 just to make our formula work. So the flow will be, pressure is the, what is that? P1 minus P2, our mean arterial pressure is 93 and the P2 is 4, right? And then the resistance is 1. So that gives us, why not we make it a little easier? Let's make it 3. So that makes it 90 divided by 1 equals 90 milliliter per minute. And then you can convert it to seconds. But important thing here is this. Important thing is what will happen if the pressure gradient changes. So let's reduce the pressure gradient. Instead of 90, if it becomes 80, what does 80 mean? Either this 120 became 110 or this 3 became 13. The gradient, the difference is becoming smaller. Imagine if the total difference becomes just 0. There will be no flow. Put that 0. 0 divided by 1, no flow. So as the gradient reduces, the flow will reduce. So that is a direct relationship. If the gradient increases, if this 120 becomes 240, then this side will almost become double as well. So that proves that the flow has a direct proportionality with the pressure gradient. So when you are practicing medicine and you want to increase the flow in a patient's body, what you need to do is you need to play with the pressure gradients and volumes, of course. You'll have lots of pharmaceutical ways to do that, but that is a basic concept. Now let's look at the resistance. Let's make the flow, the pressure gradient constant and change the resistance. So the pressure gradient here, I'm going to do this. Let's say 93 minus 3. And now this time we'll make resistance 2. How do we change the resistance? Remember, there are arterioles. The arterioles have alpha 1 and beta 2 adrenergic receptors, and we can actually, our sympathetic and parasympathetic systems can manipulate those to increase or decrease the resistance in them. So the radius of the blood vessels is really important to change the resistance. Sometimes in pathological conditions where there is anemia or there is hematocrit increase, viscosity does some work as well, but you would never expect the length of the blood vessels to change. So length would stay constant for the most part. Viscosity can change, but let's not go there for the time being. Let's just talk about resistance change, because that is happening in healthy individuals. If I just start lying down right now, my arterioles would start changing their diameters to adjust the blood flows and pressures. And then if I come back up, that would happen again. So now we have changed the resistance to 2. And now, of course, the flow is going to become 45 milliliters per minute. So flow is inversely proportional to the resistance. If you increase the resistance, flow will reduce. If you reduce the resistance, flow will increase. So that is the relationship of the flow to the resistance, and our body has levers to change both. Our body can change pressures by changing the force of contraction, and our body can change the diameter or resistance through adrenergic and sympathetic and parasympathetic systems. So thank you very much.